Have you ever felt this way after a day of walking, standing in the kitchen, or simply sitting for a long time? By evening, your ankles start to feel tight. They seem slightly swollen, with a dull ache and a bit of warmth. Then the next morning, when you step out of bed, your ankles feel stiff and you have to rotate them a few times before you can walk normally. Many people think this is normal. It's just from standing too long, or that's how it is when you get old. But have you ever wondered, why are your ankles so stiff when you wake up in the morning? Is it possible that during sleep, blood and fluid that should drain out are getting trapped? If that's the case, then could just one special position change everything? In this video, you'll learn a simple position, no equipment needed, no medication required, that can help reduce ankle swelling, make your legs feel lighter the next morning, and even help you sleep deeper by relaxing your nervous system. Just 30 minutes a day, done correctly, you'll see a clear change after just the first few nights. So what's the simple solution we just mentioned? It's not medication, nor is it a complex massage device or medical equipment. It's just a very familiar position, but done correctly, both in terms of time and height. Experts call it 15-15 elevation. The name might sound technical, but it's actually very easy to remember. 15 minutes, with a 15 centimeter, about 6 inches elevation. And what's special is, this position not only makes your legs feel relieved, but many studies have also noted that it can draw pooled blood and fluid back to the heart, quickly reduce ankle swelling, support circulatory recovery in people over 60. In fact, in treatment guidelines in the UK and the US, this method is used as part of post-injury recovery or in the care of leg ulcers caused by poor circulation. What makes it stand out is, with just gravity and a pillow, you can create an effect that previously required diuretics, compression bandages, or physical therapy to achieve. So, why can such a simple position deeply impact your vascular system, nerves, and even your sleep? Don't take your eyes off the screen, because we're going to unlock that right now. At first glance, it's just about lying down and elevating your legs. Yet behind this seemingly simple action lies a sophisticated chain of mechanisms that scientists have confirmed using microcirculation measurement devices, soft tissue ultrasounds, and even diagnostic standards in critical care. Imagine this. Throughout the day, blood flows easily from your heart to your legs, thanks to gravity. But to return to the heart, at this point blood has to flow uphill, passing through a series of toll booths, venous valves, muscles, and meters of winding vessels. If you sit a lot, stand for long periods, or your circulation weakens with age, blood can get stuck in your legs, leading to fluid leaking into tissues, causing swelling and heavy legs. When you elevate your legs about 15 centimeters, 6 inches higher than your heart, the correct standard for 15-15 elevation, you're reversing the game. Gravity now helps blood and fluid return to the heart like water draining when a valve is opened. The magic isn't in the pillow, but in the powerful physiological responses that occur inside your body when your legs are raised above your heart. Let's look closely at each effect to understand why this position is so simple yet so effective. First, reduces venous pressure, the first key to draining swollen legs. When we stand or sit for too long, venous blood in the legs, especially at the ankles, is held down by gravity and has difficulty returning to the heart. This increases pressure in the venous system, leading to swelling, pain, and a feeling of tightness as if they might burst. But just by raising your heels about a hand's width, 15 centimeters above your heart, gravity immediately reverses, pulling blood and lymph fluid towards the center. Venous pressure decreases and the venous valve system no longer has to strain against gravity as when you're standing. This creates a favorable condition to immediately reduce stagnation at the ankles. Second, increases skin blood flow by 45% in minutes. One of the most compelling pieces of evidence comes from research using laser Doppler technology, a tool for measuring microvascular blood flow in the skin. The results showed that when patients with venous insufficiency elevated their legs above their heart, the amount of blood flowing in the capillaries under the skin increased by an average of 45%. This means that when performing the 15 to 15 elevation position, not only does blood return to the heart more easily, but blood nourishing the skin tissue in the legs, an area prone to dryness, cracking, and ulcers, also significantly increases. Do your legs often feel cold, or is your skin dry and pale? The reason might not be the weather, it could be that blood isn't reaching them properly. Third, helps interstitial fluid drain out. Ankle circumference reduced by up to 1 centimeter in just 48 hours. Not everyone knows that swelling isn't just blood, it's primarily interstitial fluid that's trapped and unable to drain into the lymphatic system. A study comparing 2 leg elevation positions after ankle injury showed that if you correctly perform the leg elevation position for 15 minutes, repeated every few hours, then after just 2 days, your ankle circumference can decrease by an average of 1 centimeter. This is an improvement that can be measured with a tape measure and further confirmed by soft tissue ultrasound, a widely used diagnostic tool in rehabilitation medicine. Fourth, helps blood return to the heart, increases cardiac output without IV fluids. A physiological response few would expect. When you elevate your legs, about 300 milliliters of blood from the lower limbs returns to the heart within the first few minutes. This is called the passive leg raising (PLR) effect and is used by critical care physicians as a clinical test to assess fluid responsiveness. For older adults, leg elevation not only helps blood return to the heart, but also temporarily increases cardiac output, improving perfusion to vital organs without needing additional fluids or medication. It's a natural, gentle, and incredibly safe way to replenish blood. Fifth, helps relax the nervous system, reduces stress, and promotes deeper sleep. Elevating your legs, lying still in a quiet space, combined with slow and steady breathing, all create a very powerful nervous system recovery effect. This position is similar to a yoga pose called legs up the wall and is classified by the Cleveland Clinic as restorative yoga, helping to calm the sympathetic nervous system, activate the relaxation response, lower heart rate, reduce blood pressure, and decrease night muscle tension. This is also why experts recommend performing this position about 30 minutes before bedtime to fall asleep more easily, sleep deeper, and no longer wake up with heavy lower legs. Sixth, supports ulcer healing, reduces recurrence, especially for older adults with venous disease. In the UK's NHS treatment guidelines for venous ulcers, leg elevation is considered an essential component alongside compression stockings and topical medications. Maintaining low pressure in the lower leg area, reducing blood and fluid stagnation, helps damaged tissues heal faster and prevents recurrence in those who have had ulcers. This is because the ankle area has an extremely sensitive capillary network. If it doesn't get rest and good circulation, it will be prone to injury and difficult to recover. If a simple position can simultaneously reduce swelling, increase blood circulation, relax nerves, and help heal wounds, is it worth spending 15 minutes a day, especially when its effectiveness has been verified by instruments, clinical data, and the real-world experience of thousands of people after surgery or living with swollen, tired legs every day? Dear friends, now that you understand why the 15-minute leg elevation position twice a day has such incredible restorative power, it's time to move on to the most important part: how to perform it correctly, safely, and effectively from the very first time. First, please don't be too stressed or worried about preparation. Everything you need can be found right in your own home. Just a slightly thick pillow, about 15 centimeters, 6 inches, or the low edge of a sofa is enough to create the ideal height for this position. A thin towel placed under your feet can prevent slipping, and if you want to enhance the feeling of relaxation, you can play some gentle music with a tempo of about 60 to 70 beats per minute, equivalent to a relaxed heart rate. This type of music not only provides comfort, but also synchronizes with natural breathing as a way to guide your body into a self-healing state. When everything is ready, choose a quiet place, free from distractions. Then, lie on your back on the floor or bed, but a crucial note here: do not place your heels directly on the pillow, as this will overstretch your hamstrings. Instead, place the middle of your calves, the section between your knee and heel, on the pillow. This placement ensures blood can easily return to the heart while allowing your entire calf muscles to relax. Now for the important step: adjust your position so that your heels are about a hand's width higher than your heart, equivalent to 15 centimeters or 6 inches. This is the height proven to be optimal in clinical studies. Too high can cause muscle strain, too low won't be effective enough. Once in position, don't rush. Gently close your eyes. Take a deep breath in for 4 seconds, hold for 1 second, then slowly exhale for 6 seconds. This 4-1-6 breathing cycle not only helps your nervous system relax, but also slows your heart rate, paving the way for better blood and lymphatic return. If you feel slightly dizzy during breathing, it could be a sign of a slight drop in blood pressure. At this point, simply pause, rest, and then try again for a shorter duration. Maintain that breathing rhythm for 15 minutes. No need to count or constantly check the clock. Just play a piece of music that lasts exactly 15 minutes. When the music ends, the position is complete. Throughout this time, you might feel a gradual warming sensation in your legs, or sometimes a slight tingling. These are signals that blood and lymph are circulating well again. At the 15-minute mark, also avoid lowering your legs abruptly. Gently flex and extend your ankles about 20 times. This movement is like a biological muscle pump, helping to push any remaining fluid back to your heart before you sit up. Only then, use your hands to slowly roll to your side, then gently raise yourself up. All movements should be done calmly, avoiding standing up too quickly as it can cause dizziness, especially for those with unstable blood pressure. Now for the equally important part: timing. Ideally twice a day, once about 30 minutes after lunch, when your body has partially digested and needs a gentle midday break, and again in the evening about 30 minutes before bedtime. This is when your leg veins have been working all day, and this position will help relieve accumulated pressure, creating conditions for deeper sleep and leg recovery. And here's a small, highly effective tip I'd like to share with you. Every 45 minutes of prolonged sitting, stand up and raise your heels 20 times, calf raises. This simple movement, combined with the 15-minute leg elevation position, will help maintain continuous blood circulation throughout the day, preventing blood pooling that causes swelling and pain. If you work at a desk, you can set reminders on your phone or use a watch with a movement reminder function. I also want to emphasize that while this position is very simple and requires no medication or medical equipment, you should always listen to your body. If you experience chest tightness, shortness of breath, or a racing heart during practice, stop immediately and consult a doctor. No exercise, no matter how good, is suitable for everyone in every situation. Have you ever tried elevating your legs after a long day? If so, you'll probably agree that the relief your legs feel is wonderful. But if you haven't tried it for a full 15 minutes, at the two optimal times of day, you might not have experienced the profound effectiveness that this simple position offers. Give your body a chance to release the silent pressures that have accumulated over the years. Let your legs, which support your life step by step, rest and recover in a gentle yet effective way. And who knows, after a few days of consistent practice, you might notice your ankles are no longer swollen, there's no dull ache at night, and each morning step becomes steadier and lighter than ever. There's something that needs to be reiterated very clearly and cautiously before we conclude this practice journey. Although this is an incredibly gentle and easy habit to adopt, not everyone is suitable to start immediately. It would be remiss to only mention the benefits without addressing special cases, individuals whose legs are bearing heavier burdens or whose circulatory systems are no longer able to adjust as quickly as before. For these cases, instead of applying it right away, the most essential thing is to consult a healthcare professional first. First, if you are living with severe heart failure, especially congestive heart failure, elevating your legs can cause a dangerous phenomenon called sudden venous return overload. This makes the heart receive more blood when it is already weak. The consequence is that chest tightness and shortness of breath can occur after just a few minutes. If you've ever felt this sensation when elevating your legs, please do not continue. Consult your cardiologist before deciding to maintain this habit. Second, for those who have been diagnosed with deep vein thrombosis, DVT, especially in the calves or thighs, elevating your legs can alter blood flow pressure and dislodge blood clots, posing a risk of pulmonary embolism, an extremely serious complication. If you are taking anticoagulants, have a history of DVT, or have experienced unexplained swelling in one leg, avoid this position until it's confirmed safe. Third, for those who have recently undergone hip or knee replacement surgery within 6 weeks or are in orthopedic recovery, incorrect leg elevation can overstretch the newly replaced joint or cause soft tissue imbalance around it. This not only affects recovery effectiveness, but can also slow down the tissue healing process. During this period, it's best to follow the physical therapy program prescribed by your doctor, because sometimes even a wrong angle can create an unwanted hindrance. It's also important to mention cases of glaucoma, an eye condition that many older adults live with unknowingly. Lying on your back with elevated legs can cause increased intraocular pressure if maintained for too long, especially for those with a history of headaches when bending over or changing positions too quickly. If you are using eye drops for glaucoma or have been warned by an ophthalmologist about eye pressure, discuss this habit with them before adopting it. Another group that needs to be mentioned, though less common, are those with generalized edema due to severe liver or chronic kidney failure. In these cases, the cause of swelling is not solely due to blood circulation, but also due to poor fluid filtration and excretion mechanisms. If you elevate your legs without being able to regulate the excess systemic fluid, your body might react by retaining water in other areas like the lungs or face. The warning signs here are often a feeling of abdominal fullness, chest heaviness, or reduced urination after elevating your legs. If you belong to this group, please do not attempt this at home without medical guidance. Let your doctor instruct you on the most suitable adjustments. So how can a normal person check if they belong to a group that needs caution? It's very simple. The first time you perform the position, choose a short duration, just 5-7 minutes. While lying down, if you feel dizzy, nauseous, have a headache, or your heart races, these are signs you need to listen to. When you finish, if you feel chest heaviness, burning in your legs, or your skin is redder than usual, you should stop and monitor further. This could be a temporary reaction due to circulatory pressure changes, but if it repeats multiple times, don't hesitate, ask your doctor. Another small tip: before getting into the position, try measuring your ankle circumference with a soft tape measure, like the kind used for tailoring, then measure again after 15 minutes. If your ankle circumference slightly decreases by 0.3-0.5 centimeters without any unusual symptoms, that's a positive sign. But if it doesn't decrease and is accompanied by discomfort, your body might not be ready for this pressure release method. We understand that hearing "should not do" or "avoid applying" might make you feel disappointed, but please remember, our goal is sustainable health, safe recovery, not blindly following trends or rigidly applying methods. There are hundreds of ways to care for your legs, and everyone has their own suitable path. If you don't belong to the special groups mentioned above, then congratulations. With just a pillow, some music, and a quiet time, you can absolutely begin your journey to improve circulation, reduce swelling, and support sleep starting tonight. And if you're concerned because you have unusual symptoms or complex underlying conditions, don't hesitate to ask. A 5-minute conversation with your doctor can help you avoid 5 weeks of unnecessary treatment. So, if you don't belong to the cautious group and are truly committed to making this position a regular part of your evening leg care routine, how do you start and how do you know you're on the right track? The answer lies in a small plan, lasting just 4 weeks, no pressure, no expensive equipment, just a little patience, a pillow about 15 centimeters, 6 inches high, and a few minutes each day. You'll feel the change. Week 1. Gentle introduction. In the first week, don't rush. Think of this as getting acquainted with your body. Just choose 2 suitable times during the day, once after lunch and once about 30 minutes before bedtime. Each time, just 10 minutes of relaxed lying, elevating your legs so your calves are level with your heart, breathing gently, listening to slow music, or simply closing your eyes to let your mind rest. In the first week, the goal isn't noticeable results, but rather to feel. Do your legs feel lighter afterward? Are your ankles less stiff the next morning? In the second week, if your body responds positively, increase the holding time to 15 minutes each session. This is the threshold where studies show clear effectiveness in blood circulation and fluid drainage. At the same time, you can add a gentle movement called calf pump. After lying still for 15 minutes, slowly flex and extend your ankles a few times. This is like gently squeezing a water pipe from the bottom up, helping blood return to the heart more smoothly. The sensation afterward is usually warm feet, lighter calves, and less heaviness. In the third week, we'll add a powerful internal helper, a glass of diluted, unsweetened orange or lemon water, consumed about 15 minutes before getting into position. The reason isn't vitamin C, as many people think, but rather the potassium and citrate content and its ability to gently support sodium excretion through urine, which helps reduce tissue water retention, one of the causes of leg swelling. Don't worry if you can't drink sour liquids, you can dilute it further or substitute it with unsalted cucumber juice. The important thing is to create conditions for the excretory system to further support the circulatory system. And then in the fourth week, when everything has become a habit, this is when we start to measure clearly. Prepare a soft tape measure, like the kind used for tailoring, and measure your ankle circumference early in the morning before any activity. Record that number, then continue the leg elevation habit every evening. At the end of the week, measure again. If you see a reduction of 0.5 to 1 centimeter or your shoes feel slightly looser around the ankle, that's a very positive sign. Your body is responding, blood is circulating more smoothly, and interstitial fluid is no longer pooling as before. But what if after 4 weeks you don't see much change? Don't be disappointed. Each body has its own adjustment speed. What's valuable is that you've built a gentle, harmless self-care habit that can be combined with other factors, such as reducing salt in dinner, gentle post-meal exercise, or foot massage with essential oils. It's consistency that truly makes a difference. And one important thing, throughout those 4 weeks, take notes or confide in yourself every evening about the sensation in your legs. No need to write extensively, just a single line. Today my legs feel light, ankles less stiff, or still heavy, but not as uncomfortable as before. These notes, after a month, will be like a recovery diary, so you know you're on the right track and no longer feel like you're doing something vague. So we've reached near the end of the journey of a simple position, yet one that holds very profound effects. No pills needed, no expensive support equipment, just every day, dedicating 15 minutes, elevating your legs slightly above your heart, and letting the flow within your body heal itself the way it was programmed millions of years ago. There might not be fireworks or applause when you lie there quiet and breathing steadily, but inside your body what's happening is blood flow is starting to return more smoothly, tissue fluid is no longer accumulating around your ankles, and your heart is gently supported without needing IV fluids. Each time you do this, you're lightening your heart's burden, helping your legs feel less sluggish each morning, and making it easier to fall into a deep sleep at night. Imagine a small stream, once stagnant at the foot of a hill, now cleared, gently flowing towards the center. Not rushing, not hurried, but steady and persistent. That's how 15 to 15 elevation impacts our body, gently, consistently, and without harm. And from that small habit, the body begins to change in very real ways. In the morning, there's no longer that familiar stiffness around the ankles. In the evening, there's no need to rub your feet due to a dull ache after a long day of standing. And most importantly, your mind also calms down. Those minutes of quiet stillness each evening unintentionally become precious time to reconnect with yourself. Just one pillow for leg elevation, a quiet space, and a little commitment to yourself. That's all it takes to begin. And if you're still wondering, is such a small habit worth trying? Then please remember that all great changes begin with the smallest things. Don't wait until your legs are too swollen, until your sleep is disturbed, or until your heart speaks out to start taking care of yourself. Start tonight, so that tomorrow morning you can walk lighter with a renewed sensation in every step. Tonight, before bed, dedicate just 15 minutes to elevating your legs on a pillow, breathing gently, and relaxing your mind. No need to do anything complex. Just lie still. Let your legs rest in the way they deserve. And then tomorrow morning, before stepping out of bed, try feeling your ankles again, or gently measuring their circumference. Who knows, you might notice something different, lighter, softer, more comfortable. If so, don't hesitate to share your feelings in the comments below. Each of your shares could motivate someone else to start caring for their legs properly. We look forward to seeing you on the next journey, so that every step after age 60 is always steadier and lighter each day.